a lot more about psoriasis is Dr. Keith Lovin with Rivergate Dermatology and Skincare Center. So good to have you here with us today.
Oh, it's very good to be here, Amy.
You know, this is an autoimmune disease. I know that. But tell us, what are some of the triggers? What causes this autoimmune response in some people?
Yeah, and Amy, we really don't know. We know that genetics and your immune system play a major role in psoriasis, and then beyond that you have triggers that get everything going, but we're not sure why that occurs. We do know that a lot of the patients that have this are just sailing along in life and really have nothing that they can really tell that's out of the ordinary, but it will just flare up for them.
Mm-hmm. Yeah. Is there a certain age of onset when you tend to see psoriasis more?
Yeah, yes, there is, and it's a bimodal curve. I mean,
what does that mean?
you have an increased number of patients in their early teens and mid-teens and early 20s that will get it. Then it kind of levels off a little bit, and then in the 50s and 60s you'll get another surge and people will be diagnosed with psoriasis. We think that the earlier ones are more of the genetic, the later ones may have more of an environmental factor, but it's a combination of both of those.
Are a lot of the cases, the majority, associated with things like heart disease, diabetes, and I read even depression?
Yes, you have a lot of comorbidities that are associated, and we think that the common denominator is the inflammation, because psoriasis is an inflammatory disorder, and these others are, and you have diabetes and high blood pressure, increased cholesterol, triglycerides, heart attacks, strokes, all are increased in patients with psoriasis, and so it's so important for them to go and get a good physical and keep an eye on their health, because they are at increased risk of these things.
What are the symptoms? I think of a lot of uncomfortable itching and scaly kind of skin.
Yes, and they do, and some people have the itching and others will not, but it can, if you have them like on your palms and soles, they can fissure and they can crack and form a lot of pain. Some people do get a lot of the itching when it comes up on the body. In certain areas of the skin, it can macerate or turn really moist, like under your arms and in the groin, and can cause a lot of problems like that. You also have nail disorders that can occur because of the psoriasis. Also, you can have tendon problems and pain and joint pain because you have psoriatic arthritis that is also associated with psoriasis.
Do you tend to have it more on your hands and arms? You don't get it on your face typically, do you?
Not typically.
Not typically.
The most common type, is the plaque psoriasis, and that is mostly on your scalp, on your elbows, knees, and on your lower back. But it can occur anywhere. Yeah.
Okay. How do you diagnose this? How is it diagnosed?
Yeah. It is a clinical diagnosis. There's no special blood test to be able to tell whether it's psoriasis or not. So you come into your dermatologist or healthcare provider, and they will examine you and see whether you have, the typical psoriasis. Family history can be important. With the family history, if you have somebody who comes in with psoriasis, usually about a third of them will have a family history of that. And if you have one parent that has psoriasis, the child has about a 10% chance of having the psoriasis. And if you have both parents that have psoriasis, they have about a 50% chance of having offspring with psoriasis. So there's a definite genetic tendency.
Okay, so there is that genetic predisposition, it sounds like.
Yeah.
But as far as it being passed from one person to the next, is it contagious?
It is not contagious.
It is not?
Absolutely not.
Okay.
And so that's something that everybody needs to realize, because, when patients go up and they're people with psoriasis and they go into the store, people kind of flinch back a little bit and say, what's going on and what do they have, and which is a terrible thing, and that's why it's nice we have so many new treatments. But the people with psoriasis, have had a really hard time, and it's been really nice that we're having new things that are coming on with that. And we know that about 10% of the population has the genes that are passed on, one or more genes that predispose you to psoriasis, but only 2 to 3% actually get the psoriasis. So, there are other factors other than plain genetics that causes psoriasis to manifest itself.
Is there a way to prevent it if it's in your family? Anything? I mean, do you stay out of the sun? I mean, I know it's not good to be in the sun anyway, but are there certain things you can do to hold it at bay? Or?
Actually, this is one of these conditions where we actually tell patients it's okay to get in the sun. Yeah. because sunlight actually helps. Of course, you have to, be careful not overdo it, but there's really nothing to prevent it. It's one of those things that if it's going to happen, it's more bad luck in life. But once you have it, then there are things that you can do to try to help, keep it from flaring up so much. Eating right, staying healthy. Don't do anything excess like the drinking or smoking and that, and just stay, just a healthy body, because it's like any systemic disorder, and it is a systemic disorder. It's not just on your skin. Your overall health will influence how bad it is.
What are some of the treatments? Because we talked before about the light box treatment.
Yes.
So you said now there are more oral medications, or is it more topical or oral meds?
Yeah. I've been in practice over 30 years now. And when I started, there were the topicals and the creams, the steroid creams. We did the phototherapy was a big part of that.
I remember that.
And then I've been fortunate enough to be involved in a lot of clinical research with a lot of these new products that have come out, and they have just revolutionized things. The biologics are the ones that are really the drugs that are you're seeing on TV.
Is that the Humira?
Humira, Umbrel, Raptiva, Stelara, Tremfya, Cosintex salts. A lot of these, and we're no longer, back in the day, when I was first started, we had drugs that if we could get somebody 50% better, we thought we were really accomplishing something. And then when the studies first came out, if we got 3/4 improvement, now people are talking about 95 to 100% clearing, and it is just fantastic.
Wonderful.
I mean, and it's something that it's fun to treat, and we always enjoyed it and got people better. But it really is fun to treat now.
So good news on that front on psoriasis. Thank you so much for coming in and talking to us.
Well, you are so welcome. Thank you.
All right, good to see you again.
Yeah.
And we'll be back with a whole lot more right after this.